All right. Well, again, thanks everyone for joining our Faculty Resiliency series. And we are very excited and grateful to have Dr. Franklyn Cladis here with us today. Dr. Cladis is a professor of anesthesiology and perioperative medicine here at Children's Hospital of Pittsburgh. He trained both in internal medicine and anesthesiology at the University of Rochester School of Medicine and completed his anesthesiology fellowship at the Children's Hospital of Boston. He is board certified in internal medicine, anesthesiology, and pediatric anesthesiology, and also has an MBA that he acquired from the University of Pittsburgh, Katz School of Business here in Pittsburgh. Dr. Cladis is our anesthesiologist in chief of the Division of Pediatric Anesthesiology, and he provides anesthesia care for infants and children in both the OR as well as on the pediatric pain service and the pediatric liver transplant team. His areas of clinical interest include the anesthesia care of children with having craniofacial surgery, as well as pediatric perioperative pain, point of care ultrasound, as well as education. And he is the editor of the 8th, 9th, and 10th edition of Smith's Anesthesia for Infants and Children. From an education perspective, he's the program director of the Pediatric Anesthesiology Fellowship and has been for 18 years. And he has served on the board of directors for the Society for Pediatric Anesthesiology and Society for Education in Anesthesia. He is a full examiner for the American Board of Anesthesiology applied exam and was the past chair of the ABA Pediatric Anesthesiology Exam Committee. And he has also been a member of the Pediatric Anesthesia Program Directors Association since 2010 and is now a past president of this organization. So very excited to have you join us, Dr. Cladis, and he'll be speaking to us about negotiations and navigating that emotional landscape.
Great. Thank you. Thank you, Kavitha. And thank you for the introduction. That's actually, I would say one update, Lindsay Stolings is our program director now. She's doing an amazing job for our fellowship. Yeah, she's awesome. But actually, when I transitioned the division chief role, our person who was going to be PD had stepped away. So Lindsay is amazing. So I'm very excited to announce that. So navigating the emotional landscape in healthcare. It's similar to a talk I just gave in the fall. And it's a topic I talk about a lot when I talk about conflict. And I've been involved with conflict workshops. And probably many of you have actually sat through some of these workshops where you've done your TKI. And the TKI and the conflict workshops really start to help us figure out kind of a framework to think about conflict and how to engage it. But there's a part two to it. And I think the part two is this piece here where we think about the emotions and emotionality and how they impact how we think about and how we interact when we have complex conflict. And so that's what I wanted to talk about. And I'm going to talk about really two skill sets and a framework that I think really make a lot of sense as far as helping us to become maybe a little more effective, maybe optimize those interactions. I'm going to talk about emotional intelligence and conflict intelligence. I think a lot of people haven't really heard of the term conflict intelligence, but I'm going to talk about those two things and why they may matter when we do have really difficult, strong conversations, communications that do involve conflict, and how it really may have an impact on ourselves, our colleagues, and our patients and their outcome. Because when we think about emotions are, they're everywhere. Emotions are important. They're potent. They certainly are. Our emotions, they drive us. They guide us sometimes. They lead us, and they inspire us. And sometimes they actually mislead us. They really do. When you think about, and in fact, when I say mislead, I think because, and this is certainly true, emotions often will drive our behavior and decision-making more than facts. Emotions will drive your decision-making and behavior sometimes more than facts. And that is absolutely true. And you just have to look at the world to see some of the choices people make, and they're emotionally driven without being fact-driven. So understanding that can actually be really important. I do have some Elsevier royalties for our textbook. And I want to start with some stories that really just drive home the impact of strong emotions and how they can actually play a strong role in our healthcare environment. These are all true stories. Some of them happened to me. And first one is, imagine you're in this situation where you're walking down the hallway and at CHP, and a colleague approaches you and says, boy, the care that you guys provide on the pain team is negligent, and you're the cause of the opioid crisis in America. You're the cause of the opioid crisis. And I think we should look into that and maybe have some leadership take a look at that. Imagine the emotions that go into that. Or now imagine you're going to take care of a kid. There's me being shocked by that. Now imagine you're actually going to take care of a kid for a procedure, and one of the parents, as you're getting consent, declares themselves as a lawyer in town who's prominent, and that nothing had better happen to their child because they'll know how to find you and they'll sue you. I mean, imagine that emotional response. Or you're rounding and you're in a patient room with an adolescent and the parents, and you're talking about options for medications, and you mention acetaminophen, and everybody in the room jumps on you and says, absolutely not, that will cause autism. Zero chance of using Tylenol, it will cause autism. So imagine the response to that. And you could swap out Tylenol for vaccines or something else that has a lot of strong opinions and emotionality around it. These stories all invoked an emotional response in the individuals who were exposed to this. And the reason I'm telling this is because the emotions, they're everywhere. And they're part of who we are. They make us wonderful humans. And sometimes they're a little bit complex. And I love the Plutchik color wheel because the Plutchik color wheel basically helps us start to untangle some of the complexity and say, you know what? There's really, basically, Plutchik in the 80s said there's really 8 primary emotions. And emotions were essential. They're essential to our evolutionary success. If you think about this, I mean, emotions help drive some of our behavior so we're alive and we survive. I mean, if there's fear, maybe fear is telling you that there's danger around the corner, and maybe you should be more cautious or do something about it. Or anger might enlighten us to the fact that there's an obstacle in the way. And we have to think about how do we clear the obstacle. And anger sometimes depends how you respond to it, but these emotions can have some real benefits in helping us understand and interpret our environment. But the problem with emotions is I think there's some complexity to it. And I think that complexity is unrealized. And just over the years, when I've talked to people in different moments of conflict, we've had to debrief scenarios, often I hear people say, I'm feeling this, and that's it. And as you listen to them, you realize there's actually a few other emotions in that, in your conversation, in your statement. And there's layering here that can occur. And in fact, in those stories I just told you, I would argue that, for that experience, I think with the lawyer, there was probably some fear. In fact, with certainly in the lawyer or the colleague who approaches you of malpractice and the opioid crisis, maybe there's some anger there. And certainly for all of them, there's some surprise. Like, really? Are you serious right now? So you can see how there's actually the emotions can come together in kind of a kaleidoscope. And the complexity is, I think, sometimes unrecognized. And what's really unrecognized sometimes when you ask people the why, what do you think's behind that? Why do you think you're experiencing that? To really appreciate why can sometimes be challenging. And it's important because emotions are really involved in some of our crucial, difficult, or complex conversations and conflict. And the reality is, conflict, I think, is often misunderstood because of the emotionality and the heat that gets infused in it. Because people think of conflict as this. They often say, oh, conflict is like these two fiery fists of fighting. In fact, it is funny, over the past 10 years, we often ask the audience in a workshop, we'll say, describe conflict in one word. What would one word be? I would say 80 to 90% of the time, that one word is a negative emotion. Things like um, annoying, angry, scary, unhappy. Like, ugh, I want to avoid that. It's not good. It's rare that someone actually will say conflict. Actually, it's opportunity, or it's about enhancing a relationship. People don't think of conflict that way. But if you think of what is conflict, it just means that my wants, needs, and desires, my agenda is different than yours. That's it. My perspective is different than yours. That's it. The emotionality that gets infused into it, that's up to the two people involved. But all the conflict is that we look at the world differently. We have different needs right now, different views or perspectives right now. And how we respond to that is what's going to matter here. And the reality is conflict has to exist. It's normal. It's everywhere. It's natural because we're all individuals. We all have different wants, needs, and desires. expect conflict because it's part of our beautiful world, and recognize that sometimes in these complex conflicts, emotions do get infused. And what's really critical is to recognize the emotionality because sometimes the conflict becomes about the emotion than the task at hand. And it will derail us from trying to solve some of these complex conflicts. And you see this everywhere today. I mean, you see it in our politics, where we have a government that either functions or doesn't function because of emotionality and heat and rhetoric that is really unproductive. And really, are we getting to the why, or are we just fighting because we're fighting? And you see it, it doesn't matter if you're like on the left or if you're on the right. I mean, it doesn't matter where you are, or if you're independent, or if you're in our school system with diversity, academic inclusion. All these topics create moments where there's conflict. And we certainly do experience conflict in the healthcare setting. We experience it with our colleagues. We sometimes experience it with patients. And what's really important to understand this is if the conflict is intense and if the emotionality is intense, with like strong fear, anxiety, or anger. That emotionality can really alter our performance as healthcare team members. And when you think about this, strong emotions, which can really be brought about by these conflicts, can really disrupt how we learn, how we communicate, and handle cognitive load. And all these things can evaporate in those moments where there's a lot of emotionality and degrade our performance. Pavlov's dogs in 1923, there was a Leningrad flood that came along, and Pavlov's dogs, remember, you train them, you ring a bell and they salivate. This trained response, they're conditioned. In those dogs that were trapped in the flood in the basement, the technicians had to rescue the dogs, and these dogs were literally drowning. They were treading water with their snouts just above the cages, trying to stay alive, and the dogs had to be submerged, dragged out. And when the dogs were then recovered, and survived and went back to training, they noticed that for many of these dogs that were terrorized, all their previous training was erased as if they had never been trained before. So it can really impact our ability to learn properly. So fear, anger, anxiety, that emotionality can really be important. And what's important too is when we do experience fear, anxiety, or terror in a conflict or conversation, our behavior may not be optimal. In fact, sometimes it will create behavior that would be categorized as incivility. And incivility matters because when we see or experience incivility, our performance on a team is degraded. Described multiple times. One paper came out in 2015 in pediatrics describing NICU teams. These are NICU teams that were randomized in a randomized control fashion to simulation. One team was exposed to incivility, the other team was exposed to nothing. And the incivility was not that significant, but the team exposed to incivility had all the characteristics of decreased communication, which is typical. But the part that I found really fascinating was their ability to arrive at the correct diagnosis. Their ability to generate a correct differential diagnosis was impaired. Their ability to handle cognitive load and performance was impaired. You see this also in anesthesiologists, multi-center trial looking at anesthesia residents who are exposed to a Confederate surgeon who is demonstrating incivility. Those residents exposed to incivility in the operating room, their ability to make the correct diagnosis was degraded. Their performance was impaired. The part of this that I thought was really fascinating was when you asked them, well, what do you think that incivility did to your performance? Most of them said, nothing. I'm a professional. I can handle this. Here I am. I'm a professional physician. I can handle these things. They were unaware of their degraded performance. And that's fascinating to me because you often hear this. Over the years, when I've seen incivility on the floors in the OR, people often say, I can handle it. I can handle it. I'm a big person. And the answer is, you can handle it. You should think you're handling it, but your optimal performance has now been ratcheted down a little bit. Incivility matters, and it matters for patient outcomes. JAMA Surgery 2019 looked at 13,000 patient encounters for 202 surgeons and looked at their reports of unprofessional behavior for 3 years. And the surgeons who had the most reports of unprofessional behavior from their colleagues were the ones who had the highest degree of medical and surgical complications. So incivility matters. And the reason I bring this up is because incivility is often a product of an emotionally unregulated state. where someone feels like they're having an emotional response and they react. And to be fair, often that emotional unregulated state is brought about because you live inside of a system that might be a little bit toxic, might be bringing on or uncovering or unmasking some of that behavior. But incivility matters. And this is why we talk about emotions. It's driven by often unregulated emotions. Really important here. So, what is a potential solution for these moments? Not every conversation is like this, but those moments where it's going to matter, where there is conflict that is infused with fear, anger, rage. How do we actually navigate that environment so it's actually optimized? Well, this is the two skill sets I was talking about. Two skill sets. One is the emotional intelligence and conflict intelligence. Emotional intelligence, most people have heard about that. That's emotional intelligence is being self-aware, being self-regulated, then being socially aware and socially regulated. Those are the typical framework for emotional intelligence. Cognitive intelligence is a linguistic skill set. It's using language to ask questions and listening to understand so we can actually understand the why behind what's happening and help uncover solutions that did not exist before and to help maintain a relationship. It's a linguistic skill set that everyone can practice at and become better at. I'm going to talk a little more about some of those questions and skills that we can use, but it's using these two skill sets in a framework that might actually help us arrive at a more optimal conversation or solution. And that framework is this. That framework is to use emotional intelligence and conflict intelligence to calibrate, then connect, and then educate. We're going to start with calibration first. But what's interesting is when I watch people in a conflict sometimes, many people start with educate first, meaning, let me tell you why you're wrong. Let me tell you why I'm right. That's educating, but you're doing it before you're actually calibrating and connecting. You got to do those two steps first. But what does it mean to calibrate? Well, step one in calibration means you calibrate yourself first. What does that mean? That means you need to be self-aware and self-regulated. So self-awareness means it's that emotional intelligence piece. It's like, what am I feeling? Jealousy, anger, fear, joy, happiness, whatever it is. What am I feeling and why? And it's not that easy to understand those components. As we talked about before, sometimes we think, I'm angry. And actually, behind that is some jealousy. And you don't even realize that. Being aware of what's driving that emotion can be really important. And that self-awareness piece, it reminds me to talk about when we think about self-awareness is also about owning your emotions. It's basically saying, you know what? If I'm angry, upset, or pissed off, or whatever it's going to be, I have to own that. That's me. And I'm feeling it because of who I am and where I am and how I look at the world. And that sounds like I'm blaming everybody, like, but I'm not. I'm saying you need to own your emotions. And if you're upset about something, it's your emotion and you're upset about it. And you need to own that. And you're upset about it because of how you're thinking about the world around you. So I can tell you the identical stimulus that's out there will trigger different emotional responses in different people. Great example, I was engaged in a conflict with somebody who was being I was interpreting their behavior as rude and vicious, and I was responding with anger and rage. I was thinking, I was so angry listening to this person go on about something, attacking myself and this other person. Afterwards, when I was talking to the other person, their response wasn't anger. Their response was uh, a little bit of humor because they were like, "You're ridiculous." I interpreted that external stimulus, that person who was kind of chewing us out, as vicious. They interpreted them as ridiculous. Same stimulus, different emotional response. I was feeling heated. They were feeling like, this is ridiculous. Still have to handle that. That's not appropriate. That behavior is inappropriate. But we're feeling about it differently. It's fascinating. Being self-aware, what drives that? It reminds me of 15 years ago when a mom or dad would bring their kid in and be, oh, by the way, my kid, no one get an IV in him. Last time we were here, they poked him 15 times with an IV. And my emotional response was, my day's ruined. Thank you, you ruined my day. Because now I'm going to look like an idiot. I won't be able to put an IV in your kid. I'm going to have to call for help. the surgeon's going to be upset because it's going to take me extra time to get an IV, and mom and dad will probably write up a PSOR because I poked their kid 10 times. Emotional response to that stimulus, but thinking clearly about it, saying, yeah, I'm upset about that because I feel like I need to acquire a new skill set to handle that. And I did. And learning ultrasound changed all of that. And now I use ultrasound all the time. And so now it's interesting, it's fascinating to me when parents bring their kid in and they're like, that this just happened last week. Kid comes in, 160 kilograms, super difficult, it's gonna be challenging. And my response was, this is gonna be fun. This is awesome. It's kind of a highlight of my, this is, we're gonna, one poke will be done. Let's get the ultrasound. Mom, come over here. Let's do everyone watch. I mean, the kids with difficult IVs didn't change. That external environment didn't change. How I think about my world and the emotional experience I have to that world is what changed. Being self-aware becomes really important. And then when I'm going to respond, being self-regulated. Self-regulation matters. How we respond to our external stimulus matters. A lot of the Stoics talk about this. It's not what happens to you that's important. It's how you respond to it that matters. Self-regulation becomes important. People often confuse this with this. In fact, people have said, oh, it's emotional intelligence about emotional manipulation. It's not. It's about being aware and being regulated. Calibrate yourself first. But a really important note here, when you calibrate yourself and think of yourself, think of self-care. Because if you're not okay, I don't care how much you value being self-regulated, you won't be. If you are continuously exposed to moral injury, or if you're burnt out, or if you're sleep deprived, you will not respond in a way that's emotion regulated. And I've been the product of this. I have clearly behaved in a way that's unprofessional when I am up all night long, and I have another little conflict that creates an emotional reaction, and I respond in a way that's not entirely emotion regulated. Self-care. Take care of yourself first. Put your mask on before you help others. This is really important. If you're in a system that is continuously exposing you to sleep deprivation, burnout, moral injury, that's important. This can be a source for a lot of instability that's out there. Take care of yourself. If people on a team, on a healthcare team, feel valued, feel like they're working in a space where they have the skill set to do what they need to do, and they feel like they're okay, that team, the outcome, the natural outcome is going to be amazing patient care. It's a little bit like Delta, the Delta model of business. Take care of your employees, passengers will be amazing. They'll think your product's amazing. So you've calibrated yourself, now you got to calibrate the other person. Where are they? What's their why? Where are they? And as you're listening, this is really important. You want to listen to understand, not listen to respond. Cocktail party, often we listen to respond. I was just at a social event on Saturday night. People are like, oh yeah, oh my gosh, let me tell you what happened to me. You're listening to respond. In this conversation, we're trying to listen to understand, really understand where they're coming from. And there's three simultaneous conversations that are occurring in this moment. One is the facts. And be mindful, the facts aren't necessarily the facts that you think they might be. Facts may be based more on how the person values things than how you perceive it. So the facts may be slightly different here, but listen for the facts, listen for the feelings. And as this person is talking, if they seem to be very upset or angry, you may need to name it, or at least let them understand you can feel where they're coming from. Name it will sometimes tame it. Really important to actually understand what emotions are getting heated, recognize it, recognize that feeling, and maybe even address it. And three is identity. What's happening to their core, their identity? Identity is things like I'm competent, I'm lovable, likable, I'm autonomous. If those things are threatened in a conversation, this whole thing will shut down. You'll move away from the why, and it'll become about the emotional heat. The whole argument will become about emotionality and not the why, and it won't help you arrive at a conversation to uncover solutions. Really important as you try to calibrate to the person, listen for the facts, the feelings, their identity. And as you do, as those emotions do come up, recognize there's complexity here. So when they do come in, emotions come up, and say anger is an emotion that's coming up, remember, there's complexity to emotions. What's behind that anger? Is it fear, depression, anxiety, jealousy, shame, isolation? What's behind it? What's some of the features that are driving that. And this recognizing that actually opens up an opportunity to allow some space for compassion, to keep listening, to understand, and make an assumption, allow you to make an assumption that maybe there's good intention here. And Indra Nooyi talks about this. Indra Nooyi is the CEO of Pepsi, 2006 to 17, I think it was. She said the best piece of business advice she ever got, one of the best pieces, was from her dad, who said, whatever anybody says or does, assume positive intent. And you'd be amazed at how some of the emotionality drifts away because you're listening to them and assuming that, okay, there's some heat here, but maybe there's good intent, and I can listen for that. And maybe that will engage and actually improve the relationship so you can understand what's really happening. You've calibrated yourself, you're listening to them, calibrating them. Now you're going to try to connect. And connect means you want to actually build trust. Connection means trust has now developed or occurred. And connection means you're going to have to keep asking some of those questions to understand where they're coming from, to make them feel heard. And questions, I call them calibrated questions. Chris Voss calls them calibrated questions as well. And what's really important about the calibrated question is a question, it could be a coaching question too, but a question that has curiosity without judgment or agenda helps you get there and becomes really important, and it invites the other person in. When you think about the conversation that has facts, feelings, and identity, we often ask questions. We always ask questions, but often our questions look like this. We have questions with lots of curiosity and lots of judgment. I mean, think about that. I mean, I know the emotional experience I have when I hear about people who don't want to vaccinate, and I have a response, and I might want to say, why would you think vaccines don't save lives? Can you honestly say you think this is a good idea? Oh boy, that's curious. There's curiosity there and a lot of judgment. If you really want to try to bring somebody on board, maybe have a conversation where they'll continue to engage you and maybe arrive at the point where you can start to educate, maybe the question should be one with curiosity, with no judgment, no agenda. And the question might be, what information has been most influential for you? How did you come to that conclusion? Curiosity, no judgment. And it may actually really help you understand where they're coming from. Feelings, I kind of want to say, why are you scared? You shouldn't be. It's ridiculous. Judgment, maybe what worries you most about vaccinating your child? What worries you most? How do you feel when doctors bring up vaccines? Tell me what's going on inside. And then identity. Boy, I mean, as a parent, how could you not think about healthcare of your child? Judgment, but maybe tell me what kind of parent you hope to be regarding your child's health. What values have guided your choices when there's uncertainty? These questions can help actually uncover where they're coming from and can help the other person you're dealing with, help them feel heard and accepted. And that doesn't mean accepted like you agree, but it helps them feel like, oh yeah, okay, they're actually engaging in a way that they're actually listening to understand. And so the common theme with these calibrated questions is they have to signal curiosity. And the question, and typically people say, don't use why questions because there's a lot of judgment in why questions. But I'm telling you, how questions can have a lot of judgment too. Like, how could you believe that? That's crazy. Judgment. But the question should signal curiosity without judgment or agenda, should signal acknowledgement. And the acknowledgement could be as simple as just repeating back the core piece of what they said to you. Huh, you said this about that. Did I get that right? Acknowledging it, finding common ground, maybe zooming out a little bit. Maybe you both agree that what you want for each of you is the health of their kid. You both agree on that. That's important. And hedging with humility. I love this paper because it's really fascinating. And I just heard a graduation speech from a student at Harvard last month that actually really touches on this. Hedging with humility instead of dogma. And you often see this in these, I'm going to tell you what it is, and I'm going to basically double down on this. Dogma, telling you why it is because I'm right, you're wrong. Dogma, whereas sometimes when we engage with some humility, and the humility suggests that maybe I don't understand all of it, or maybe I could be wrong on this piece about it. Hedging with humility is basically asking questions that says, it's not just listening to understand, it's listening as if I might have some of this wrong. And apparently in this, when Leslie John did the study, the people who hedged with humility were perceived by the other individual as being more knowledgeable, more thoughtful, and some as more competent. It's fascinating. So it's really, I think, hedging with some humility allows that environment to occur, that environment where that rich soil that maybe allows them to keep talking and for them to maybe have an insight. That's important. So this concept of tactile empathy, Chris Voss talks about this. It's kind of combining these skills, and these are these conflict intelligence skill sets we talk about. Linguistic skill sets, asking calibrated questions, and having a regulated response. So when they say stuff that's a little bit what you think is emotionally heated, we respond not in kind, but we respond in an emotionally regulated, mature, and constructive way. Mirroring, mirroring back their last sentence. Sometimes all you have to do, and they'll keep talking. Labeling, labeling where they are maybe emotionally. When you do that, you look like somebody who's curious and somebody who cares. They sense some sense of compassion. When you engage somebody who looks like they're curious and they care, you feel like you've been heard and accepted. Remember, not you don't agree with them. Accepting doesn't mean you agree with them, but accepting means you've allowed the space for them to have this conversation. And when you do that, when they feel accepted and heard, they actually have connection and trust. You've now connected. And now you're in a space where you can actually now start to educate. You can now start to collaborate with them a little bit, maybe push your agenda a little bit with them, maybe negotiate a little bit with them, push it a little bit, and introduce some concepts or knowledge or information. And what's key about this, though, as you do that, it's a continuous cycle, though. This is so true in so much of our social interactions, particularly ones that are crucial, challenging, or difficult. We want to calibrate, connect, and educate. And as you're educating, you may be realizing, oh, I'm losing them. I need to recalibrate and figure out what's going on, and then connect and then go back to educating. This can be a cycle. And when there's a lot of emotionality, and there can be, boy, there can be a lot of emotionality in some of these conversations. Sometimes there's a misstep, or sometimes the emotions can erupt or disrupt. And when that happens, if it happens because you have an emotional response, and I've been there, I've said something that I regret, I need to apologize. If you say something that's not okay, you've got to apologize. An apology, this is really critical because an apology, when done well, will repair the relationship and allow you to get back into that cycle. An apology that's not done well looks like gaslighting and will actually make the whole scenario worse. And I've been in a situation where people have made apologies and they think they made an apologies. I remember being in two scenarios where one individual made an apology and afterwards I was debriefing with the person receiving the apology and the apology looked like this. I'm sorry you felt that way. And afterwards the person said, that was horrible. I actually feel worse. I feel like they were blaming me. And you know what? I think I will call HR. Like, uh-oh. The other situation I was in where I was like, I'm going to coach this individual about their apology. And it really needs to have these components. Boop, these components. Accountability, meaning you own what you said or you own what you did, because those are your words. Own it. And then you acknowledge the shame or the pain or the embarrassment that you created for them. You acknowledge that pain. And then you make an announcement or a judgment that, you know what, that was not okay. I own it. It hurt you. And it was actually not okay on my part to do that. And an aspiration that you won't do it again. If it has those essential components, it actually turns out there's like 7 or 8 components, but those are the essential components. If you have those components in an apology, you usually will repair the relationship. And this other individual, when I coached them, their apology was really good. It was so effective, the whole thing went away. The whole issue, the whole conflict went away. It was really gorgeous because it allows you to get back into the cycle where now you can calibrate, connect, and educate, recalibrate, reconnect, and educate. Because this cycle goes on and on. And the beauty of having those skill sets with that framework is it allows us to really, when we do have to have some of those difficult conversations, challenging conversations, crucial conversations, it allows us to maintain the relationship. And that is really important when you think of healthcare because these relationships are often go on for long term and they matter. So I'm hopeful in the time we spent together that I've been able to kind of reframe the challenge. We talked a lot about emotional intelligence, conflict intelligence, but the challenge here is, I think, how people often think of crucial, challenging, or difficult conversations, the ones with lots of conflict and heat. I think the challenge here is that people think of those interactions as horrible. Like I'm so good at those conversations because I avoid them and I never have them. I just avoid them. They're horrible, they're a burden, they're emotionally draining, but I'm hopeful I've created a space, an opportunity for us to say, maybe they're not horrible. Maybe they're opportunity to actually discover some innovation for something or to create some creativity. And maybe most importantly, maybe it's a chance for us to actually reestablish a relationship that didn't exist before or grow a relationship that may have been damaged before. It's about growth. I think that that becomes, hopefully we've reframed it that way a little bit. And it's about saying, emotional intelligence is not about manipulation, which sometimes you'll hear this. Emotional intelligence, it's been weaponized. It's manipulation. It's not. Emotional intelligence is about connection, understanding yourself, understanding where the other individual or team may be coming from, and trying to enhance the connection that exists. It's basically saying, you know what? I'm going to focus on the connection with curiosity and to focus on curiosity when it's way easier to judge. Let's face it, it is. I mean, my spouse tells me, my spouse says, Franklin, you're a judger. And I'm like, I'm not at work, I'm not, because I'm trying to really actually understand what's happening. And conflict intelligence isn't about winning. Like, yeah, I'm better at this, I'm going to win. Conflict intelligence is actually about using our language to ask those questions and our ears to listen, to understand. And listen as if we might not understand all of it or could be wrong about something. To understand in that way so that we can have an insight or they can have an insight that allows us to actually, again, innovate, create, find solutions that maybe didn't exist before, but more importantly, to enhance the relationship. Because when we're in those moments, those challenging conversations, those challenging conflicts, one of the individuals, maybe even yourself, and you can do this, where we exhibit that emotion intelligent, regulated, mature response, it allows that space for the other person to maybe say, uh-huh, okay, I've been heard. I've been accepted, and it allows that conversation to go on so we can actually find some answers that become really important or help them find an insight that helps them grow. So it's often what we need to do is help people find those moments where they get to grow. And all of you can do this. And it's going to be beneficial for yourself, for your colleagues, and for sure for your patients as we minimize some of the instability and maximize our cognitive performance. So with that, I'd like to thank you guys very much. It's 12:40. Yeah, I usually talk about 40 minutes. I do want to comment on some books that I think are super fun and actually cover a lot of this material. But Beyond Reason, Difficult Conversations, Crucial Conversations, Never Split the Difference, talk about a lot of these concepts. Conflict intelligence isn't necessarily in these books. That's from some other literature. But also for teams, Fearless Organization by Amy Edmondson talks a lot about psychological safety, another topic that I love to talk about. But I think it's important when we think about how we create those spaces where we can optimize our conversations and relationships. So thank you very much. It's 12:40. I think there is time, Kavitha, if I'm wrong, I guess there's time for some questions. If people have questions, I'm more than happy to stay on and to chat.